Welcome to the Growth Mode podcast, where real conversations fuel real business growth. Hosted by Nina LeVay, media strategist with Salem Surround. Get ready to listen, learn, and grow. This is Growth Mode.
I'm Nina LeVay, the host of Growth Mode, and I'm so glad you are here. My guest today is Joel Kay, nurse practitioner and co-owner, and medical director, Dr. Salvador Abrams of Infinity Primary Care in San Antonio. A clinic offering affordable, relationship-based care without the constraints of traditional insurance. Joel, thank you for being here, being a guest on Growth Mode. I'm excited to have you on.
Oh, no, we're excited. Thank you for having us.
Awesome.
Okay,
okay. So we got to find out about your story.
Sure.
So before we get into what direct primary care is, I would love to know what inspired you to pursue this model of care in the first place.
So the inspiration comes from, it's multifaceted answer. So like we had previously talked about off camera was we're also in the urgent care world and the ER world. And so when we're episodically taking care of patients that you have a lot of face time with, and you're thinking, how did we get here? Mm-hmm. And a lot of it is because they couldn't get somewhere else. They couldn't get to primary care. That's a big portion of what we meet. Mm-hmm. And second inspiration came from the fact that we have a lot of talent at the clinic, clinical talent. Mm-hmm. And what I mean by talent, meaning individually our providers have expertise in, I mentioned urgent care, ER, but they also have primary care, kidney disease, diabetes. Mm-hmm. And I said, why not maximize that talent with an audience that needs it, that can't get it? And so we did go the traditional route of, in the weeds a little bit, healthcare, trying to, when you hear about, are you with my plan? Are you in network? So we tried to go that route. We've been in the business a long time. There's steps to do that, right? Yeah. So we took those traditional steps. We made the calls. Insurance just said, oh, our panel's full. We don't need any more primary care in San Antonio. And as we're staring at thousands without primary care, it's like, that's weird, Blue Cross, that's weird. And so is there another model? Yeah. And that model says, what if we directly, so we are primary care, but a non-traditional payment system, right? And so the inspiration came from that, just being able to service folks that had the need, us not being able to get into network, because it is a controlled monopoly. Right. And so in this model, when you're able to cut out insurance companies and cut out billing companies, then you come up with a price and you live by that price.
So creative.
Yes. So that's where some of that long-winded answer for inspiration came from. It was multifaceted to make it happen.
Okay. Now, for those who aren't familiar, can you tell us what exactly is direct primary care and how does it differ from the traditional healthcare model?
So from a clinical setting, it's the same, right? You're going to meet the provider, you're going to talk about your preventative medicine or your chronic conditions, right? And let's use the most common ones, hypertension, diabetes, okay? Yeah. That's the most common. And where we spin off is now it's if you become what we'll call a membership-based, it's membership-based, so it's a monthly fee of $60. Direct primary care has all variations, but our model is $60 a month, and that now establishes your relationship. And in that relationship, we can talk any health care and take care of it in the best way we can. Where traditional model is look at your insurance card, who takes it, who has appointments, am I in network, the whole steps that people traditionally know about. We've wiped out all those steps. So
okay. All right. Now, Infinity Primary Care, like you said, offers the memberships for $60 a month. Can you explain like what's all included in that and how it helps keep care affordable?
Yes. So we'll stay focused on the primary care side because that's the most common is what's included is your annual labs. Let's start with that. So you get to know right off the bat, how's your cholesterol, how's your thyroid, how's your kidneys, liver, some of those basics that we're always wondering, how are they doing? So in that price is included your annual labs.
Okay.
And then for male services, also included is prostate check. Okay. Female services, just because that is a little bit more pricey, that's $50 a year. On top of the $60, it's a $50 one-time fee, and now you get all your female services added.
Right.
And so from a traditional primary care standpoint, that's what's included.
Okay.
Now spin it into this part. Because we are membership-based, our panel of patients is much smaller. Okay, much smaller. A traditional practice, let's call it a solo practice, group practice, could have thousands and thousands of patients.
Yes.
We max ours at 1,000 patients. So that allows us now to be on call 24/7. So every member has our direct number. So you have any questions, you need anything as a member, you call the number.
I would feel so spoiled.
Yes, and that's the goal is to feel that way, because what gets people in trouble in healthcare is scary, just clinically and financially. If we can take out the scary parts of healthcare, a good portion of people will seek it before it becomes catastrophic. So if I can address your cholesterol early,
right,
versus when it causes a heart attack.
Sure.
Right? So, or causes a stroke. So, we're trying to alleviate that with healthcare. Healthcare is notoriously, unlike if you go to a restaurant, you look at a menu, you see a price. Name healthcare industry you walk into, you know the price. No one knows the price. Until the end, and then it's usually a big number. So we love being transparent. So I guess that's a key word in what we do too.
I love that, and it's a great deal. It's a great deal.
Oh yeah.
The fact that you'll be seen for longer than 5 minutes.
Correct. And also knowing you have a phone number to call. A lot of our visits are telemedicine. So with technology, Zoom, FaceTime, we can accomplish a lot from the comforts of your home or your office. And
that makes it so convenient.
So the spin-off, and now this becomes a little bit more how we do it also, is now that you have that number, we also are in the traditional urgent care model, right? We have that. So we've added those services to our model. So now imagine you have that sore throat or you're worried about flu. You come to the urgent care, and it's still labeled Infinity Primary Care. It's kind of a hybrid.
Right.
Now, you pay $10 when you walk in, and everything in those 4 walls is covered.
Wow.
X-rays, flu test,
That's amazing.
strep tests. So there's no more checking out like, hey, let me get your bill and racking up bills. It's $10. It's all included. And again, not every model has that privilege. Ours does. So it's a beautiful thing because that episodic care. So we went from preventative and chronic to now your episodic care is covered. And from sprained ankles, to like I mentioned, some of those viral illnesses or the bacterial illnesses, skin rashes, earaches, the list is long. So,
for sure.
So that's accomplished. Telemedicine visits are all free, so the phone call's free. You never pay for anything when you call us.
Wow.
And if we can service you through telemedicine, it's zero cost.
I love it.
It's in offices that $10 copay that we have. And then everything's covered in those 4 walls.
All right.
Yeah.
Well, let's talk a little bit more about understanding direct primary care. What inspired you to start Infinity Primary Care?
And so we're also businessmen, so we love thinking outside the box. When we first got together, probably the 3 things that was most important, this was years ago and we've lived by it to this day, is how can we be affordable? How can we be efficient? And can we do it with a smile? And that's not healthcare. Right? It's just not. No offense to my colleagues in the world, but traditionally, you don't get those 3.
Right.
So we live by that every day in what we do. So when we were inspired to start primary care, it was, I go back to the talent we have. We have super, super good providers, nurse practitioners, physicians, PAs, and why not maximize that talent and show it to the world? Because we, like I mentioned, we're in the urgent care model too, so we were kind of in that box, and hey, let's expand it. So that's how that came about.
All right. You know, many patients say they feel rushed in traditional appointments.
Yeah.
How does DPC allow you to give more personalized care?
It goes back to that panel size.
Yeah.
Right?
Yeah.
That's the first. And knowing we don't have a number to hit every day as far as we got to make the donuts, got to move the meat, you know, it's really personal.
Yeah.
And so another thing is a lot of things we accomplish is through the telemedicine. Go back to that. So you're not so stuck on a time constraint of I have to take a day off to go see someone all the time. Our model's also 7 days a week, so you can come see primary care if you want to see us in person Saturday and Sunday.
Wow.
Which is very rare. I don't know of anyone doing that.
Right.
So the traditional workforce is an 8 to 5. So so you can come in on a weekend, and our panel's so small. If you want to talk 30 minutes, you want to talk an hour, we can. But we can accomplish a lot in that time frame.
Wow.
Yeah.
All right. So Joel, can you share a story without giving any names about a patient whose experience really shows the difference direct primary care can make?
So the story's gonna touch on probably another question you may have later, is like, what industries do we talk to? Who do we take care of? But so imagine, talk about a truck driver. Okay, truck drivers have horrible schedules, right? And we do a lot of required medical physicals for truck drivers, and that physical's blood pressure, and we have to check things. So this particular instance, blood pressure wasn't where it should be, and mentioned to him, hey, why don't you see anyone for your blood pressure? And they go on the story about their schedule. Yeah. Right? They're not home 8 to 5, Monday through Friday, but they're home on a weekend. So I said, you know what? Sign up. We'll take care of you. Yeah. And sure enough, got the meds he needed, probably saved his kidneys for the rest of his life, and prevented strokes. Right? So that simple conversation, that simple addressing of blood pressure early, talk about dietary and medications, things like that. That is the classic story where we probably saved many years, saved his kidneys, saved his life, so to speak. Second one I'd touch on is, I know you asked me for one, but two is, because they're both very important, is barbers. Right, barbers have those crazy hours. They only make money if they're cutting hair, so they're usually off on Sundays, right? So I obviously don't go to a barber, but my son does, and I was telling this barber, I was like, who takes care of your healthcare needs? He goes, I don't. And he had the traditional look of overweight, and I said, come see me, and found out he had diabetes uncontrolled. Oh, no. But for $60, he got his labs. We found out that info. Yeah. Got on, we prescribe a lot from the very affordable, we'll call it the $4 list, the $5 list at H-E-B or Walmart. A lot of medications are on there. So prescribe that, because barbers traditionally also don't have coverage, medical coverage. That's right. And so he is now almost not diabetic based on taking care of himself. So, and I say almost, meaning based on labs, right? How they come back. And so he's lost weight, looks great, feels great. So, so again, those are the two stories that probably hit home the most, because blood pressure, diabetes. So, and be able to tackle all that for $60. Yeah. So that's tough to do. Yeah. It's tough to do.
Man, and he in the nick of time, too. Yeah. Oh, you know, before it progressed to a worser case.
Yes, for sure. Sure.
All right. So how do you think direct primary care is changing the healthcare industry? Where do you see the biggest growth opportunities?
Okay. So the change part, that is a bigger machine, right? I don't know if healthcare as a whole will conform, like think of us as, so I think of us more of what gap are we filling? Sure. Right? And so we target that audience, okay? And that segues into the growth opportunities, right? So
Yeah.
top 4 that come to mind, number 1 is the obvious one, the uninsured.
Yes.
Okay, uninsured. Again, we can't fix everything, take care of everything, but it does give you an opportunity to start somewhere.
Yeah.
And you know the price. It's very affordable. It is month to month, so there is no annual contracts or anything. So get in, come see us. Let's
Yeah.
take care of you. Let's figure it out. And if you're perfectly healthy, that's a good problem to have.
Yeah.
And keep the $60 a month going, because when you do need us, we're a phone call away. And
That's
so uninsured is that first growth opportunity. And that industry I touched on is usually, I touched on like barbers,
Yeah.
and you know the
yeah.
industries that are typically independent contractors.
Yes, and you're so right. There is a big gap in the community of people who don't have health insurance.
Yeah,
So,
yeah.
I mean, the need is there. The
Yes.
need is
Oh,
there.
for sure, for sure. The second one is what we'll call underinsured. So insurance plans, there's a million of them.
Right.
Okay. The ones that you carry an insurance card and it has a logo on it, but it doesn't tell you much more.
Right.
Most of those are high deductible. So really, what you're stuck paying is everything.
Sure.
So if you have a $10,000 deductible, which is very common now, you're responsible for $10,000.
Yeah.
And then they'll kick in. So this is a nice gap, to fill that is for $60 a month.
Yeah.
So if I travel 2 roads that, hey, can I get lab work? Can I see someone? Traditional, that'll probably cost you $300 to $400 to get labs and see the provider. You can do it for $60.
Unbelievable.
So we invite people in that realm, keep your insurance, because again, that handles if you get to the hospital, maybe help some of your prescription meds you might need. So we never tell people, hey, get rid of your insurance.
Right.
It's keep that insurance plan.
Yeah,
for when you
and
need
the
it.
person's got to do what's best for them. They
Yeah.
got to make the right decision for themselves.
Yeah. That third audience that gets captivated is the frustrated audience.
Oh.
I can't get into my primary care.
Yeah.
Right? Whether it's a school teacher who has only 10 days a year they can miss, so I have to schedule something, miss a day to go get my annual exam.
Yeah.
Well, we kind of fill that gap. Say, no, sign up with us, keep your whatever insurance you have, keep your doc, but let us be your primary care and see us on Sunday when you're usually off, you're not teaching. So, and then the last audience that I'd say gets kind of captured is employers trying to recruit talent.
Yeah.
Right? This is I feel a very nice piece of the puzzle, because we have staff and we know what insurance costs, because we pay it and they have to pay it. Those costs are, so put in perspective, we probably pay $6,000 a month for the 12 employees we have or 15 employees we have. Imagine if those 12 had a $60 plan that could accomplish a lot, and I hand you this card and says, hey, this service is with it too for working here.
Yeah.
And so those are our target audiences and just to kind of touch on.
Yeah. Speaking of the card,
Yeah,
I'm going
there
to
you
show.
go.
I'm
There
going
you
to show this card. It's a membership card that you can just keep easily in your wallet, and on the back a QR code that I guess can you elaborate
so
on
the QR code takes you directly to our website. On the website, it's very user friendly, meaning you can sign up for an appointment if you don't want to call us for one. You can just sign up right there. You can become a member on the website.
Okay.
You don't have to speak to anyone to become a member. You just sign up. We'll call you and we'll interview you and we'll start taking care of you. So it kind of saves that extra trip to a clinic to figure out if we can take care of you. Now we'll figure it out. We always figure it out. So,
all right.
so that's what the membership card and it's plastic, so it's durable, right? Unlike the traditional paper cards.
All right, I got a couple more questions before we transition to Dr. Abrams.
Taking up all his time.
All right, so I want to talk a little bit about patient experience and your care philosophy. What are some of the biggest misconceptions about direct primary care that you'd like to clear up?
All right, so the first, I have 2, okay? So one is, it's not an insurance. I got to make sure we know that, okay?
Yeah.
It's not an insurance. Our logo it's just better.
I like that.
And so, meaning we don't follow insurance models. You need us, we're here.
Yeah.
And so that's the misconception. It's not an insurance. Just want to make sure that's there, okay? And the second one is this real, right?
Yeah.
Because it's sometimes too good to be true, or because it's not a traditional model of healthcare, and it's very real. We have very real patients.
I get excited just hearing you talk about it.
Yeah, it's very real. And we take pride in it, and that's key in our work too. Is we take a lot of pride in that customer service model. So it is very real.
Yeah.
We're very transparent. We're a phone call away.
Okay.
And then I know I mentioned there was two, but actually the third misconception for you is why would I sign up? People traditionally they're waiting to get sick, and I want to say, don't wait to get sick.
Yeah.
Let's catch it early. Let's catch it before. Let's give you advice before.
Yeah.
So
before you have that chronic disease.
Yes. So if we can do that, great. It was worth $60.
Of course.
So,
absolutely.
yeah.
All right. One more for you.
Yes.
From a business perspective, what growth strategies are you using to expand your patient base?
Yeah. So for us, the strategies are obviously meeting great folks like yourself, having a voice in the healthcare community or in the business community.
Yeah.
Because healthcare is such a big machine.
Yeah.
And trying to fit this new model into it won't be met with open arms. It just won't. And so we do a lot of boots on the ground, organic growth, where I'm face to face with a lot of patients every day, and have an opportunity to talk about it. We do have marketers who you've had a chance to speak with one, and they're at the business level of going out in the community, meeting with small businesses, roofing companies, plumbers, because they're not big enough to get good rates on plans. They don't have 200 employees. And it's expensive. So hey, that's the audience that we're trying to meet. So. Yeah.
Joel, thank you so much. Thank you so much for
nice
sharing your perspective as a provider, as a co-owner. I really appreciate you breaking down the direct primary care, model and sharing that patient story.
Yes.
Yeah, it really shows the heart behind what you do.
Yes, ma'am. That's how we do it. So thank you for having us.
Awesome. And now I'd like to shift gears and bring in Dr. Salvador Abrams, Medical Director at Infinity Primary Care. Dr. Abrams not only leads with the medical team, but also has a unique perspective on how this model transforms both patient outcomes and the physician experience. Dr. Abrams, welcome. Thank you so much for joining the conversation.
Thank you for having us.
Awesome.
Glad to be here.
All right, so we're going to talk a little bit about industry insight. What first attracted you to join Infinity Primary Care?
Well, like Joel and I said, we've been working together many years, and we come from the emergency world. My specialty is emergency medicine, and we've been working ER for a long time. We did transition into urgent care, but in the emergency room, one of the things that we see all the time, but many times, is that patients go to the emergency room not because they have an emergency medical condition, but because they have nowhere else to go.
Yes.
And that sometimes cause of frustration for us as providers. But when you stop a little and talk to the patients and ask them, why are you here? In a nice way. Why this is not an emergency. They clearly know their condition is not emergent. However, they end up in the emergency room. And you find out that most of them, either they don't have a support system, whether they're not insured, or they cannot get a hold of their primary care physician, or they just don't have an emergency primary care physician. So they end up in the emergency room. Urgent care is a little different, but not that quite different. We see minor emergencies, obviously, that could be taken care at their primary care physician, but they don't, and many
Yeah.
times you ask the patient, oh, you've been sick for like 4 or 5 days with cold symptoms, for example, and they seem to getting worse. I call my doctor and, they give me an appointment in 3 weeks. Well, in 3 weeks, either you're cured or you're dead, right? So what do? They
right.
look for an alternative, And in many cases, the same thing happens, patients who have chronic conditions like diabetes, like hypertension, suddenly their sugars are high or their they're dizzy.
Yeah.
They don't have a primary care physician. They can get to one if they have, and they come to see us in the emergency room or the urgent care. So that's where we feel that there is a huge need, a huge gap where we can fill in.
Right.
Mainly.
Yes, absolutely. Now, from a physician's point of view, what's the biggest advantage of the direct primary care model, which you were kind of already talking about already?
Well, I think that in our case, besides taking care of that gap,
Yes.
where we can take care of people for their chronic conditions or prevent any problems and so
Yes.
forth, so on. Number one is the accessibility. That we are accessible. Once you're a member, you have basically unlimited access to our team. 24/7. We have also the backup of our urgent cares, which are open 7 days a week, and that we are transparent. We don't hide any costs for our patients. They know that they're going to pay their membership, and if they need to go to the urgent care, whether it's for a flu test or because they broke an ankle and they need a temporary cast, it's only going to be a $10 copay.
Right.
So transparency is a good thing for us. And the other one is that, from our beginnings in the emergency room world, Joel and I had the philosophy of excellent customer service. For me, in my years of experience, I hired number of physicians, nurse practitioners, and believe me, the easy part is find the doctor or the nurse practitioner or the physician assistant that can take care of the stuff that comes through the door. The difficult part is finding somebody who does it nicely. And if we had to choose a quality among our staff, for me, it would be kindness.
Yeah.
And that's something that we are proud of and we take care of. That we take care of our patients, not only in the medical sense, but with a smile.
Right.
And having a small base of patients allow us to know them, a lot of them personally.
Yeah.
We have our urgent care in Floresville. Joel lives in Floresville, and I think half the town has his phone number.
Yeah.
So that's our philosophy. And that's where we think that we can be successful in creating, because we are attending a gap of patients who need it.
Right, absolutely, and I love that it's so convenient too. All right, so you've had years of experience in medicine.
Right.
Yes. So how does working in this model compare to other healthcare settings?
And meaning compared to emergency or to what we do?
Yes.
For us, this is a compliment.
Yes.
A lot of the times, when you are in the emergency room or in the urgent care, in a way, you are practicing primary care. Because like I said, yes, we see the gunshot wounds and the heart attacks and the strokes, but we also see the flus and the urinary tract infections and stuff that it is everyday
You see
stuff,
it all.
So it's we're taking care, we've been taking care of those patients, but in a different setting.
Yeah.
In a more expensive setting if you're talking to the ER.
Of course.
So it's just the right combination,
Yes.
that we can offer our patients, the primary care with a backup of an urgent care.
Are there certain types of patients that benefit the most from direct primary care? Of course, the uninsured, but...
Well, I think the patients that they need primary care, that they have chronic conditions, or they don't know they have a chronic condition, those are the ones who can benefit the best, and obviously the ones who are young and healthy may not need us a lot, but I think, people in general have a hard time spending money on healthcare. Is just the way it is, they can spend a membership of $100 and some a month in the health club where they never go, but they have a harder time paying a little more or a little less for healthcare, and it's just the way it is, so we're trying to make a shift in that mentality. In that, healthcare, preventive healthcare is better than taking care of a condition that you already been diagnosed with.
Because it'll prevent those chronic conditions.
Correct.
Yes. All right. So, Dr. Abrams, from your perspective as medical director, is there a patient story or experience that stands out to you as a powerful example of how direct primary care can truly change someone's health and quality of life?
Sure. I actually have a real story. I won't say names, but it's a young fellow, 43 years old, who's my landscaper. And he normally goes to the house Fridays or Saturdays. And so he missed one weekend, and like the Saturday afternoon, and he wasn't showing up, and I was ready to call him, and he called me. And I said, hey, your ears must be buzzing, because I was right about to call you. I said, oh, hey, boss, I almost died. What do you mean you almost died? I thought an accident or something. No, he said, I was in the hospital, and I think I had a heart attack. What do you mean you think you had a heart attack? Well, it turns out that he was at work. He started to feel sick and sweating and pain. They took him to the hospital, and he was having a heart attack. And they took him to the cath lab. They put some stents. So it was like a Tuesday through Friday. They let him go on a Friday. And they gave him prescriptions, and out you go. And the reason he called me was to ask me if he could shower, and if he could take the stickies that they have left. So they didn't even take off those stickies, right? So the guy didn't know anything about his condition, what he had, nothing. He was ready to go back to work because he had to go back to work. So I told him, no, don't do this. This medicine, you cannot stop taking it because you're gonna have another heart attack. He had no idea. He didn't have a follow-up. He didn't have a doctor, let alone a cardiologist, So I immediately sent him to our clinic to get checked as a patient, make sure that he understood everything. That guy, 43 years old, he could have died because he didn't have the proper follow-up that he needed. Again, just the primary care that could tell him, you need to take these medications, you need to rest because you have a blood clot in your groin. That common sense things, And I think that's where our model can be really priceless. Because, if many times, you go to the hospital for whether it's surgery or an accident or heart attack or anything, they let you go, and the doctor that discharges you is not the one who's going to take care of you. He's the one who took care of you while you were in the hospital. And here, go follow up with your doctor, or here's the number of one doctor. And that's where they leave it, know. And those patients, they have a hard time following up with a doctor for a condition that could bring him back to the hospital. So that's where I think we come in handy in having those patients easy access to that follow-up care, which is very important.
Wow, and I've even heard stories like that too, just from over the years, just knowing people, And I mean that's why preventative care is so important, you guys. All right. So, what about innovations? What innovations or advancements do you see shaping the future of patient care?
Well, with this healthcare system we have, it's going to be difficult. Unfortunately, healthcare, we need easier access to healthcare. I think, You know,
That's the biggest problem.
this is the biggest
That's the
problem.
biggest problem.
Healthcare is access to healthcare is very difficult. It's very expensive. You know, if you have a middle-aged man or woman that wants to buy healthcare, you're gonna pay $600, $700 a month.
Yeah.
You know, and like Joel said, you still have to pay the first $10,000 or $7,000 for the insurance to put a penny in it. You
Yeah.
know, let alone if they approve this, if they approve that. I think healthcare in this country is broken.
Yeah.
It could be much better. You know, and I think we all need to work and put a little bit of ourselves to improve it. You know, so I think that access to healthcare is essential for the health of the country and preventive care more than anything else.
Yes, I totally
Yeah.
believe that. So, so for someone listening today who's frustrated with their healthcare experience, what would you say to encourage them to explore direct primary care?
Check us out. You know, I think that you'll be happy with our transparency, and you'll be happy with the quality of our healthcare. You know, our team is excellent. We know what we're doing, and we'll take care of you like if you were one of us.
I love it. What's not to love? What's not to love? This is convenient. All right, so final question.
Sure.
What does growth mode mean to you personally and professionally?
Growth don't mean you.
Yeah, just personally and professionally in general.
Personally, I mean, I appreciate the opportunity to be here. I think that growth mode means you helping businesses to grow, and you helping people, letting them know about the businesses that they want to grow within their community.
Right. Awesome.
I don't know if that was answer correct or not.
It was beautiful. It was beautiful. Now, if someone wants to learn more about Infinity Primary Care or book an appointment, how can they reach you?
We have a telephone number here on our card. That's 210-987-8945, or you can visit us at ipcdirectcare.com through the card.
All right.
And with the QR code.
Okay.
That'll take you directly to our website as well.
Perfect.
But 210-987-8945, and you'll get one of us on the phone, and we can get you started.
Okay, or ipcdirectcare.com. Okay, wonderful, wonderful. All right, Joel, Dr. Abrams.
Thank you very much.
Thank you both for sharing your time and your expertise and your passion.
Thank you.
For changing the way people experience healthcare. I hope this conversation has opened your eyes to the possibilities of direct primary care and what it can mean for you and your loved ones. To our listeners, if you've ever felt frustrated by the traditional healthcare system, I know I have, or simply curious about more personal, affordable care, I hope this episode gave you a fresh perspective. If you found this valuable, please take a moment to like, comment, or share this episode. Every interaction helps the podcast reach more business owners and change makers like you. And that support means the world to me. And if you're ready to get your business found and heard, let's talk. I'm offering a free digital strategy session and a special Get Found and Get Heard package that combines organic SEO and targeted radio, and is designed to help your brand build trust drive traffic, and generate real results. So we'll take a look at where you are and how you can grow, whether it's through SEO, digital ads, or getting found locally. No pressure, just real solutions tailored to your goals. And you can connect with me by emailing me at growthmode@salemsurround.com, or you can call me 210-526-3626. And until next time, keep growing forward.
Thanks for listening to the Growth Mode podcast with Nina LeBay. Stay connected, keep learning, and keep growing. Don't forget to like, subscribe, and share. And we'll see you next time on Growth Mode.
Want to grow your business online and on the air? Right now, when you sign up for a 6-month organic SEO campaign at $3,100 a month, we'll include a free radio schedule, 1 week per month for 6 months to help kickstart your visibility. That's a $5,000 value in radio advertising, designed to drive awareness and leads from day one. Don't miss it. Email Nina LeBay at growthmode@salemsurround.com or call 210-526-3626 to learn more.